Causes of dysfunction can be numerous. Childbirth is probably the one that I see most commonly with clients, and that's a pretty normal thing. Pelvic trauma, of course, if you've been in an accident or some kind of shock to that region. Age, unfortunately, so many things happen with age. Obesity is another one that's going to cause some issues with pelvic floor, and obviously surgery is going to impact as well. There could be secondary dysfunction because of, and this is a very big thing, this is possibly even bigger than the childbirth issue for me with my clients, is that they have that weakness in the coordination, okay, because they're shallow breathers. Or otherwise, so in other words, if they're shallow breathers and they're not terribly active and they haven't overused the abdominals, they're probably not going to be very strong in that pelvic floor group. If they are very active, and I was guilty of this to some degree myself, very, very active individuals can over-recruit that muscle group. So in other words, we become very, very rigid in that group. It's very tense, and it almost can't relax. So it's in this rigid setup, and there's no capacity to release. Now, over-recruitment can lead to a lot of UTIs, a lot of urinary tract infections, because you can't empty the bladder properly, because you can't relax the pelvic floor. Okay, that's really important. Same with incomplete bowel emptying. Same with the frequent urge to urinate. If you're needing the loo every 15 minutes, you're not emptying fully. Leaking of urine, so of course that's a big one for a lot of women. So we've got pain or discomfort, spasms in that region, in the pelvic region. So treating over-recruited pelvic floor is actually, to be fair, it's similar to, I would do the same exercise for over-recruitment and under-recruitment. So obviously relaxation is very important. Learning how to relax, all of that is important. And to coordinate your breathing pattern is really vital. Now, deep breathing per se is just a very relaxing process for a nervous system in general. It aids relaxation. So it's going to be great for pelvic floor as well. I've spoken about specialist physios or other experts or specialists who offer the internal assessment, which is very useful feedback. It's a very good way. I mean, there are also little machines and gadgets you can use that will give you that feedback, that biofeedback. So there's lots out on the market, but you want some help with actively releasing those muscles, or you could do that yourself. So you can actually internally release the vaginal muscles so that they are relaxed when they're not actively engaged.